Hey guys, welcome to the Lunge and Lift podcast. Today we've got a little bit of a technical episode on back pain basics. One thing to get clear before we get started, a quick medical disclaimer. This is not medical advice. We're not doctors, and anything we talk about on here shouldn't be interpreted as personal advice for what to do with your own back pain or back injury. So if you are currently experiencing or suffering that, sorry to hear that, but please seek an assessment and professional advice before undertaking any sort of intervention. But hopefully the discussion will prove useful if you have experienced back pain in the past, or if you do in the future, or if you work with people undergoing back pain currently. But as always, a quick thank you to our show sponsors before we start. TheTrainingStimulus.com. Please check it out if you're interested in learning more about movement mechanics. Wit-fitness.com. Please use discount code LL15 to get 15% off your Wit kit. And Hydro, use discount code LL20 to get 20% off your blood flow restriction apparel. So, back pain, Rob, you've had it all.
Yeah, I mean, over the years, I've had like severe lower back pumps where I thought it was I'd done my backing where I hadn't. I just had a really pumped back. I've had like nervy pains. I've had sciatica. I've had slip discs. I've just fucked myself up where I couldn't move. I've honestly done it all. And it's funny because I've had this question before, and someone said to me, "It's like, so why do you do what you do?" And I think it stems from our last episode, where we talk about like when is strong enough. And for me, it's like, this is the risk. I like pushing that risk because I like to push myself, and just because it's like a passion. And when you have a bit of a passion, it's really easy to kind of think, you know what, some of these injuries might be just part of the parcel. And a lot of the time they come when I've done something I probably shouldn't have done. And it's always like, maybe I've done a little bit more weight than I should. So maybe gone a bit more towards my ego, or I've done a bit too many reps with too heavy a load. So it's always just too heavy. I've gone too heavy too quickly. And that's kind of been a consistent theme across my training career, which, hasn't necessarily been a negative because it's helped me do some absolute performances for myself. But I think the back pains, I think when we just started thinking about this, I thought it'd be really cool because we can discuss about all the pains that I've had, and maybe because they're extremely common, and it's really hard to sometimes differentiate between, say, what a pumped lower back is and say, well, actually something that's quite bad, and maybe ways to maybe get a bit more accustomed to them, that I've like strategies that I've used to kind of help, especially within the world of functional fitness, where there's a lot of high rep like movements, which kind of then tends to lead to, so like bodybuilding, which is all about the pump. So kind of in areas that you're not necessarily used to. So what about yourself? Have you dealt with many back issues?
Yeah, I've had my fair share. I think, like you said, there is a risk associated with pushing yourself. It's almost a bit like strength training or functional fitness stuff. It's almost like a type of adrenaline sport, or like an extreme sport.
The tightrope.
Because you just love being on that edge of your capacity. Like that feeling is a bit of a rush. So I think anyone who has consistently pushed themselves to their limit for a long period of time will at some stage go over that limit, and that's where these sorts of injuries happen. So it's a really common occurrence, and I've had plenty of back spasms and lower back tightness, and even to the point where it's difficult walking. I remember after one rugby match. So it's fortunately and unfortunately something that I've had a good deal of experience with personally, as well as professionally with people that I work with. So I think it's probably useful to start by outlining that there are a few different reasons, or many different reasons, why you can experience lower back pain, and getting clear on what type of back pain is really step one in doing something about it, because they are quite distinct. So as Rob said, you can get lower back pumps where the muscles in your lower back just get really worked up, and you feel a big pump, a lot of blood in the area, a deep burn if you're doing a tough workout, which in small doses isn't very sinister at all, as long as it's regulated and you're not doing anything super crazy. Then there's more sharp pains, more like stabbing pains when potentially something's moved. You might have slipped a disc, which is when it starts to get a little bit more serious. And basically anything where there's sharp stabbing or shooting pain, it tends to be towards the more serious end of the spectrum, where you might be touching on nerves, and that is more serious. So I think for the scope of this episode, we're not going to give too much advice about those, because they do require getting checked out properly. Like if you think you might have a slip disc, then you probably need an MRI, and to go about things a little bit more cautiously. But that's not to say you can't do much, and a lot of people are over precautious. But I think to err on the side of safety is always a good thing for backs and nerves.
Yeah, I think, and like talking from previous experience as well. So when I slipped a disc, had to go and get an MRI, and they looked at the back. It's like, yeah, okay, you've got a slipped disc, but also you have to understand that as people train, you don't have this perfect spine a lot of the time. So there probably is discs slightly ajar from just day to day, and they've never caused you any issues. And maybe this pump that you got in the lower back then started pushing the nerve a little bit closer to one of those discs that then caused you the issue. So it might not even been a slip disc. So it's funny. It's just a disc that was there that now is a bit closer than it should have been. And I think if we kind of work our way through some of these, and like maybe some strategies that we can say recommend, I think would be really beneficial. But one of the most challenging things to kind of deal with is, especially if you've had a back injury or you're afraid of a back injury. Like for myself, I've always had like this ghost injury where I did do my back in. So I always have this feeling, so that when I go to a certain load in my, say, deadlifts, I'm very conscious that my back could go. And it's a thought, and it's always at the worst time, literally halfway up the deadlift, just about my knee, in my head goes, wonder what happens if your back goes. I'm like, you cannot think that now. And a lot of time I fight through it, and it's just, and I can't control that thought. So unless I'm really trying my hardest not to think that. But then when you try to not think of something, and all you do is think of it, I'm like, fuck's sake. But it's funny, because it's like that ghost injury it's a valid thing. When we had Franco on in our early days of our podcast, and we spoke about it, it's like our body is very familiar with this sort of issue, and it doesn't want that to happen again. So it's going to do what it can to protect you. So, because if you've never experienced a back pain, any back pain, you don't know what, you're not scared of it. So it just then means that when maybe you get the pump in your lower back, it's something that you're like, oh no, this is really bad, when all it is just a pump muscle, just like you'd have a pump bicep.
Yeah, it's just for the listeners' benefit. If you didn't listen to our episode with Franco, first of all, definitely recommend checking it out, because it's really cool to discuss pain science in a bit more detail. But the ghost of an injury that Rob's referring to is basically, if you have had an injury in the past, it's like a relic in your nervous system that your body remembers being hurt in that part. Your brain remembers being hurt in that part of your body, and will have heightened sensitivity in that area. So you can perceive pain even when there's no damage, basically out of paranoia, because your body's like, that was really fucking bad last time this happened. I don't want that to happen again. So I'm going to put you off doing the thing that caused it to happen. So like in the deadlifts for Rob, that's when he did it the first time round. So his body has an association of the movement pattern and load that led to a bad consequence. So it takes a lot of work to rewrite that thought process, essentially, that you have to put in so many successful reps to reassure the nervous system that you can do that and nothing bad is going to happen. So yeah, phantom back pain, you could almost class that as, in that there's no damage, but there's still very real pain going on in your nervous system, and that's something to be aware of.
Yeah, so I guess we need to kind of understand what is triggering it. Could it be phantom, so from a previous disc? Is it, say, the pumps? Or is it maybe a particular type of training that you're doing? So let's maybe dive a little bit deeper into that, because I think that's key.
Definitely. I think we get a lot of clues of what's causing the back pain by the specifics of the triggers. So is it certain movement patterns? Is it any hip hinge? Is it a back squat? Is it when you're pressing overhead? So you even get people from doing standing bicep curls, their back pain will come on, or an interestingly common cause is actually doing the dishes. I don't know if it's just an excuse to get out of doing the dishes, but that slightly leaned forward position when you're standing puts a lot of pressure in some people's lower backs. Is it worse in the morning or is it worse after training? Does it get better with training? All these things can give us indications of the mechanism for what brings on the back pain, and that will inform how we can go about treating it or relieving it.
Yeah, so I guess one of the things that I've had to like deal with over the years is kind of find out what are the strategies that I can kind of use to kind of get over some of them, or maybe to like reintroduce training. So like, for instance, when I slipped my disc, I know I couldn't do any hinge work. I could squat, but not heavy. And a lot of time I was front squatting because of then where the load was loaded. And I was doing a lot of upper body work. And even with bench press, my feet were up on the bench, so I didn't have the arch in my lower back. So there was ways you can get around it. And this is a really common thing it's a common thing to not do anything. So you have a back pain, you're like, right, I need to rest, I need to do nothing. And when we had on our previous show guest, Dr. John Houghton on the podcast, and he said about like, if you've done you've injured yourself, you don't want to just rest that, because you have to demand your body to work better elsewhere. So you have to put other stresses on your body. So say for instance, when I done my back in there, I looked at ways that I could still train. So I was still training upper body because I had to have a bit more support through some of the movements for the first couple of weeks. But I was finding ways to train rather than using it as an excuse to not train. And I think that's where we always need to kind of understand that if you're able to move like day to day, like you're able to get out of bed, you can train. You just need to find what level of training you can do, because that in turn is going to help with recovery. Because if you're promoting more blood flow around the body, more blood's going to get sent to the area around that's injured, and hopefully send more nutrients, which is then going to help you recover quicker. So
definitely,
what are some of the like basic fundamentals, apart from just training, that you'd recommend that people maybe want to kind of maybe experiment with or kind of explore?
Yeah, sure. So I think one other thing to add to what you just said there, another reason why training is very important, is that endorphins actually are painkillers. So by getting those feel-good hormones from training, you can mitigate pain. So even though your back might be hurting, if you can find ways to release endorphins without aggravating the back, then you can and should. And for all your situation there where you've got a slipped disc in your lumbar spine, it massively depends on how severe it is and whether it's getting better or worse. But as you correctly said, you want to avoid sudden loaded flexion. Essentially, if you've got a slipped disc, it's getting pushed out between two vertebrae. So by moving those vertebrae a lot, you could be pushing it out further. Yeah. So while it's in the acute stage, you don't want to anger it anymore. And that's the sort of thing that you'll probably get very strong feedback to say that's not a good idea if you did do, like, for example, hinge movements. So starting to assess which movements are and are not okay would be step one there, and just focusing on the ones that are okay before giving it some time and then coming back to the ones that aren't. But like you say, I think stability through the midsection would be starting point number one for the majority of back pain situations, I'd say, because if you've got something like a slipped disc, that excessive or uncontrolled motion through the lumbar spine is what's going to cause flare-ups and trigger the pain, trigger the back spasms that can often accompany it. So what we want to do is teach the body to control that lower back so that it is ready to control those movements that is unprepared for, and the spine won't move so much in an unexpected manner and aggravate that disc. So go on.
I think one of the key things there as well that you're discussing about that midline stability, that I know anytime I've done my back in, especially working as a PT, and I'm a PT that I'll change your weights. I'll make sure I do that stuff for you, right? So I'm, even with a busted back, I'm still finding a way to change weight on the bar, unless I physically can't move. Right, which there has been a couple of sessions with people that I've said, "Can you do that for me?" But most of the time I'm still moving, and this is one of the things that if you can kind of move relatively pain-free or just enough, where you're getting a little bit of feedback there, especially when you're not in that acute phase where everything is just, you physically feel like you can't move. But when you are at that stage, maybe like a few days later, where you're starting to do just slight bits of movement, it's going to be telling your body that you're just all right, that you're all right. You can go there. You can go there. I love that one you talk about. I want you to say that analogy with the kid again, because I think that one is such a good analogy. But for me, understanding that I can do something is the first step in getting better. And I think that's the hardest part for most people. With back pain, it's the only focus. And because you're amazed at how much your back is used in nearly everything you do. And as soon as you do the slightest movement and your back is being used, oh, for fuck's sake, it's a constant reminder. So if you tell yourself, do you know what? I'm going to feel some discomfort, and that's fine. Let me just make sure it's manageable. I'm not dosing my, well, personally, I don't recommend dosing yourself up on a load of ibuprofen and stuff like that, because you want that feedback. You don't want to be dull in this pain, because you want to know what's too much. I think this is where we're so quick to take things to kind of dull the pain a little bit, that you don't get the feedback, so you can't make correct decisions. So what's that one about the kids?
So in terms of range of motion or pain-free motion, I think of the nervous system and the body or the muscles or the joints as like a parent-child relationship, in that when you've got a young child, the permitted distance you'll let them go away from home can be quite small. So if you've just been injured, the amount of movement through your back can be limited, and it's only through the process of successful movement. So if we bring it back to the analogy, for that child going to the local shops 5 minutes away and coming back successfully, if they do that enough times, then you'll let them go a little bit further afield. Maybe they'll go into town, maybe they'll go to the next town or city, until eventually they've accumulated so many successful out and backs that you'll let them go to Australia without worrying whether they can come back. If you think about pain-free range of motion in the spine, the pain and the back spasms are your body, your nervous system's strategy for saying, I don't want you to do that because I don't feel safe when you do that. So the way that we build trust between the body and the nervous system is by working within our remit of, this motion is okay, do that enough times, then the range of motion that's pain-free will grow with time. But if we exceed that, we basically trigger a paranoid freak out from the nervous system. The parents ground you, and the spine will lock up because the nervous system's like, no, we're not doing that. That's too dangerous. Like, get back in your room. So I think having that in your mindset when you've got back pain, that you should continue to move, but don't take the piss. Like, if you're getting feedback to say, this is too much, listen to it, because if you keep going too far, you're going to get a backlash, which ultimately slows down the rate of progress for improving pain-free movement again.
And understand that if you do push a little bit too much, and you didn't necessarily do it on purpose, it might be just something that you had to do and you forgot about your back pain, and you reach and it's like, oh, and it hurts a bit too much. Remember that a lot of the time that is probably just your body, as you said, saying you've done too much, and you haven't necessarily gone all the way back to zero, but you probably feel like you have. So just try not to then debilitate yourself and kind of end up back to that I can't do anything, because that's one of the saddest things when I have clients come to me, like say new clients, I've always had back pain, I've been told I shouldn't do this, or I told I shouldn't do that, I've seen this physio or that, and they're quite outdated with their data, and they're saying, right, stay away from deadlifts are bad for you. It's like, no, you can't hinge properly, you don't know how to hinge. If you hinge properly, you know it's actually more hip dominant, and the lower back might then, if it's not stable, then take more stress than it needs to. So we have to actually learn how to hinge first, so then that will start to create a better movement pattern, and then in turn create a stronger lower back. Something that I had quite a fair bit of success with, especially in a lot of these injuries, is Dr. Stuart McGill. He's well known within like the back pain world, and probably one of the most highly regarded back pain specialist in the world, and he's dealt with some of the world's heaviest squatters, and through down to your everyday person. And he likes to prescribe 3 movements, which are the bird dog, the curl up, and the side plank. And what these 3 movements are, there's also the cat cow, which is kind of that one. That's kind of one that's not a main one, but is used within that, and it's not part of the big 3, but it's kind of like the big 3 plus the cat cow, the plus one. But for me, they're great ways. And if you haven't done these movements, you can literally search online McGill Big 3, and you will find many, many things on them. But a lot of it is either taking your spine and lower back through movement, or through an isometric hold, so you're having to stabilize something, or your movement and stability. So they're like the main 2 things that it's kind of working on. What are your thoughts on the big 3? Because they're quite so thinking about, I know with your focus a lot is keeping it as close to the specific task as possible, so down that spectrum of specificity. The big 3 are so far from, say, doing a barbell back squat. So why are they so successful for helping people kind of build back to the back squat, as an example, or the deadlift?
Good question. So the McGill Big 3, like you say, don't have too much in common with our end goal of lifting heavy through big barbell movements. But if we go back to what the spine wants and needs in the acute phase, we want to restore some level of stability, some level of movement to start building up pain-free range of motion in a really safe, controlled environment. So what's great about the big 3 is that they are safe. You're not going to put yourself into a position where there's excessive spinal flexion, lateral flexion, or even rotation, but you can move in a very slow, deliberate, controlled manner. Think of it as, in that analogy of letting your kids go out on their own, it's basically them playing in the garden. You can keep an eye on them. It's very deliberate, and you can accumulate a lot of time and a lot of successful movements which don't aggravate the back. So with any generic broad brush exercise prescription, you have to cater for the worst possible case. So going super basic is the way it should be done, because there'll be a lot of people who have a lot of back pain who could do much more aggressive, much more specific movements. But if you put those into a generic exercise prescription, you're going to fuck a lot of people up who are in a worse situation. So I think for what they are, it's a great starting point, and especially the cat-cow stuff as well. If somebody has a back spasm, they're a great safe thing to, without doing any assessment, without seeing what's really going on, you can just chuck those over the fence and say, get cracking with these. You will hopefully calm the spine down and start to feel some relief relatively quickly, just because you're microdosing in some movement. And I just wanted to come back to one thing you said before about the pumps and spasms and the pain of the spine, or pain in the back, is that quite often we'll get pain and spasms without actual damage. And I think that's quite reassuring for people to hear, in that when your back locks up, it doesn't mean you've broken your back and you're going to lose control of your legs. Because the spine is so important, the nervous system is very paranoid about damage to it. So it's hyper vigilant to protect it, which is good. It ensures survival. But what that means is quite often it feels world ending that your back's gone, but actually there's no actual damage. It was just somebody putting the brakes on to say, whoa, we're not doing this today. No, but it's not necessarily that you've damaged a nerve, slipped a disc, or even pulled a muscle. It's literally just like a paranoid response. So that's quite reassuring for a lot of people when they've experienced their first back spasm, for example.
So it's something that I like to, well, not like to, because I don't like to ever really be in that situation. But if I've ever had a back issue, or I've had clients, so one of my clients, he was deadlifting just like normal in a session, was looking completely fine on the way up, and then one of these reps, back went, completely went, and it was literally the exact same thing as me. So, and I said to him, and he was just in pain on the floor. I said, right, just lie down, legs up on the bench, flat, get your lower back kind of compressing the floor. Can you do that for a start? Yes. Okay, cool. Okay, now stand up. All right. Now can you get back down, get into the cat camel? Only go within ranges that you're capable of doing. Because this is, again, even though they're basic movements, they still have varying ranges. So you can do a cat camel in a small movement or take it into a full spinal movement. And this is where I think people can kind of get a little bit confused, as they think, okay, the cat camel looks like this, so that's what I need to do. So no, the cat camel is trying to segment your spine, right, and go then the opposite way. So what it's trying to do is see how much range have you got. So I try to get someone, especially when they've just done it, to do a cat camel. And then I say, right, now stand up and walk around. And the reason for that is a lot of the time because it's not as bad as you think. And if I can see them doing some cat camels and they can get their legs up and push their lower back into the floor, right, it means they have control. It's just something's gone too far, and it can be a serious pain. And it can be that maybe something's happened that's more than a pump and probably more than, say, a pulled muscle. It could be bad. But by just giving that confidence to the person and say, right, you still have some movement, you're okay. And what I did with my client, I said to him, look, you're going to really struggle the rest of today. You're probably going to have a terrible night's sleep. You're going to feel probably worse in the morning, right? But all you need to do is keep moving. Do not sit around, because if you sit around, you're essentially putting your spine in that slightly pulled apart state, and you're not allowing it to get back into some form of compression again. So we want to move. We want to try and keep moving because it's going to help you get back quicker. He did that, and he's just lifted the most he's ever deadlifted recently. He's going to be competing on the weekend just gone, and he's, absolutely smashed it. That's the thing, is because he kept moving and he didn't let, even though it did kind of depress him a little bit at the time, he understood that it was just part of it. And I said to you, look, I don't know anyone that's deadlifted a lot of weight that hasn't done their back in. It's just sometimes it's part of like the thing of fire. And then he finally hit over 180 kilos, and that was a lifetime PB for him. And that was the thing. It's like he was never able to get there. And then the back injury was like, fuck, I'm never going to be able to get there. And then he went beyond there, because that was the thing. He then gained a whole new understanding of his back and understood actually how to brace better, because he never really had to do that. So that was the thing. It gives you a lot more of a understanding of your body. And I think you can take a lot of positives from back pains. Hopefully, I personally have.
Yeah, so I think the cat-cow as an immediate relief strategy to, like Rob says, just introduce some successful movement in whatever way possible. And for me, as always, I like to 3D things. So we want to get an idea of what range of motion we have in each of the three joint motions that we have in the spine. So the normal cat-cow would be going from flexion to extension, so rounding the back to arching the back. And as Rob says, you just want to slowly move from one to the other to see where the line is, like what level of flexion is okay, what level of extension is okay. And just by working reps within pain, like without aggravating the back further, you start to build up those successful motions. And we can apply the same strategy to the other two planes of motion. So from cat-cow, you bring right shoulder to right hip in a side bend, left shoulder to left hip in the opposite side bend. You might have very small range of motion available, but just tiny increments, you start to let the nervous system know that, okay, it's all right if I move here, nothing bad happens. And over time, it will start to let you go further and further. And for the transverse plane, for rotation, just twisting, like turning your sternum or your hips towards one wall to just create a little bit of twists through the spine. Super small movements, anything you can to just systematically restore all three planes of motion through the spine is a recommendation for like the very acute stage, just to almost to show yourself that some movement is possible. The other thing that I think is really important in these situations is to try and get as much help from other areas of the body. So this could be part of the reason why the back's gone in the first place, is that, for example, the hips aren't doing enough in the deadlift. So say your hips aren't providing enough stability to the movement, the lower back tries to take over, and that's why it's gone. So in the acute phase, if we're able to get more stability from the hips and better control of gross overall movement, that's another reassuring signal to the lower back. So it's tightened up because it thinks you're out of control. It's like there's a madman behind the steering wheel, so I need to fucking just stop him. Whereas if you can then say, hang on a minute, the hips are coming to the rescue. I'm going to introduce some dynamic control of range through the hips, getting some more stability through the major muscle groups of like glutes, hamstrings, adductors, even hip flexors. If that's happening, then the lower back's like, okay, you know what, this guy's not so crazy, and maybe we can allow a little bit more motion. So in terms of like immediate strategies for dealing with it, those would be my two key go-tos.
Yeah, I think as well, like from myself, from then kind of going beyond the acute phase and then going into like coming now into long term, something where I made sure I put a big focus on is, if my, like you mentioned there, if my lower back is taking a lot of the unnecessary stress and it shouldn't have taken that, I need to look at why is this happening. So for instance, when I done my back in, what I did, I got rid of my belt. I got back to beltless deadlifts again, up into heavy as I could. So I was like, well, this is back when it was like about a week or two later. And because I had a competition in, I think it was like in 4 weeks or something like that. So I fucked my back, had to compete and lift the heaviest thing I could in 4 weeks time. So I had to get that back quickly. Now, I then went beltless deadlifts because I had to keep that specificity as close as possible to what I had to do. So by watching that, I was then seeing things. So when I'm then filming myself, I'm seeing my back losing tension. So I'm seeing that when I'm actually lifting, that I've lost core tension that I was trying to have in the deadlift, and it just disappeared. And it started to then, my lower back flex. And I was all right. I can now see, because I got rid of the belt, I could see what was going on. So then what that meant is then after my competition, I then went through a phase of doing some pause deadlifts. And they were all beltless. So I did beltless deadlifts for ages while I was trying to bring back my strength. And I said this before in a previous podcast, but the problem is I went from going from, say, triathlon training to strength training in like, say, 8 weeks. And I went back to nearly the heaviest I've ever lifted in a short amount of time. My body wasn't able to keep up. So my strength come back, but my body wasn't able to stabilize that strength. And that's then why then the back went. And so I understood it all. And I was like, fair enough, it is what it is. But now going back into like past experiences, what I then made sure I did was give exposure to my back, doing things like GHD reverse hypers, doing back extensions, doing Jefferson curls under control, like that, getting my lower back exposed to flexion, load, and also in different planes, because this is then when we go into the 3D thing, adding some rotation. So if you haven't downloaded our deadlift download, you can head over to lungeandlift.com and download it there completely for free. Your 4 exercises you're probably not doing. The 3D deadlifts were one of the things that really helped me get control of my back again, because I was then exposing myself to positions that I'm just not normally doing. And I was like, okay, I can do this. And just like you said, like with the kid, it's that thing of, if you've been there before, you feel a lot more confident. You haven't got to lift, say, 200 kilos in this sideward state, but you have to be able to maintain some strength that maybe you have twisted slightly and your body thinks, I've been here before, I'm all right. I can maintain 20 kilos here. So It's just that.
Yeah, spot on. And I think the way I think about that is, for almost all injuries, you've exceeded the tissue tolerance of a body part. So if you've exceeded the tissue tolerance of your lower back, there's 2 reasons why that could be. It could be that your lower back or your core is just weak and can't handle the requisite amount of stress, or it could be that it's doing proportionally more than its fair share and other parts of your body should be picking up the slack. And there's no reason why we can't approach both of them in a corrective program. So improving your technique, improving your movement mechanics so that your hips and legs do more of the work in the deadlift, so the lower back doesn't need to do it, would be the biomechanical way of addressing it. But also we need to improve the tissue tolerance of the lower back itself. So like Rob was saying, they're doing things like Jefferson curls and 3D deadlift matrix to build up its work capacity so that the amount of stress that's required to exceed its tissue tolerance is higher. But also we've got reinforcements from the other body parts which will do more work. So the lower back needs to do less. So we now have a stronger lower back that needs to do less. We've got a double win, and we're much less likely to experience the same injury again in the future from both ends of the spectrum. I think that's a nice way to frame your like rehab and corrective journey.
Yeah, and I think like as well, like when I mentioned about like the back extensions and doing exercises like that, one of the reasons why I like them is they're like a safe way to give a lower back pump, because most of the time, in like especially within within say CrossFit, functional fitness, that type of training, and you've got high rep say deadlifts, using them or any high rep barbell, but generally say high rep deadlifts. A lot of the time, you lose that correct movement pattern of a barbell cycling, and you see people just end up going into their lower back. And they're not comfortable with having a pump because they don't know what that feels like. So like when we alluded to at the start, it's like you got this discomfort in your back and you're just like, oh no, I've done something really bad. It's like, no, your back is just pumped up, like when you have a pumped up bicep or a pumped up quad. It's like, you're like, oh, it's a bit hard to move if your legs or, your biceps, I can barely straighten my arm. It's just really pumped, but you don't think anything too bad about it. It's just a really overtrained muscle for that moment. So doing things that say back extensions or say high rep deadlifts in training, maybe at lighter loads, gives you that thing of, okay, this is what it feels like and it's okay as long as, but this is again the caveat though of, I'm not now telling you to go and fuck yourself up by going and do loads and loads of reps and then going beyond, because this is where we have to learn our body, and sometimes we do push too far, but taking note of what was too much, so that okay, cool, that was a bit too far. Let me work just underneath that then and build out that tolerance, just like you said with that tissue tolerance. Because I think it's very easy to have a back injury and say, right, deadlifts are bad, can't do deadlifts, that's it, never do a deadlift again. It's like, no, you just need to deadlift better.
Mm-hmm. Or at the right dose.
Or at the right... Yeah, I guess because I'm saying better is then, okay, yeah, because maybe better is you going too heavy. So this is the thing, because you've gone too heavy, so that's you not deadlifting better. So yeah, so obviously we're saying the same thing there, because it's really horrible to hear people and they say, oh, I can't deadlift, I've got a bad back. And it's just like, one of my friends come to me and I started training him and he couldn't pick up his kid and just was in severe discomfort all the time. Got him got basically built him up, cat cows, bird dogs, loaded stuff, taught him how to hinge, got him deadlifting at his body weight, got slightly over that, and he could pick up his kid again. And that was it. And it was such a good win for me, because he didn't give a monkeys about the deadlifting. That was my measure for him. But his measure was being able to live day to day, not in pain. So I just used hinging, and I used understanding what the lower back should feel like and how it feels to use it as a tool to help him in day to day, so that he could pick up his kid and not worry about pulling his back. And he did in that time. I think it was a couple of weeks in, he kind of done it again a little bit, and he was like, whoa. And I was like, no. It was always going to happen, because you thought you was better than you was. You didn't understand, which is normal. You think, oh, I'm fine now, because you didn't feel any pain. And then he did some of it, and he was like, okay. And I was like, no, look, come back. We'll go back. And he progressed very quickly, because then we kind of went back to what he felt comfortable with and progressed just like we did through very quickly to then where he then felt comfortable getting back to deadlifting. And that is, I think, one of the most important bits is having a plan. And if you don't know what the plan is, talk to a professional. And this is the thing, it's like, that's when he come to me, or he was working with me, I was able to say, look, this is what's going to happen and this is how we're going to deal with it. Because sometimes we just overanalyze and get too worried about something it's just don't need to be worried about.
That's it. So I think, to wrap it all up, I think the key takeaways about back pain basics are that there's lots of causes for back pain, and trying to identify what your mechanism of injury is step one in trying to understand how you go about addressing it. We commonly see like excessive use of the lower back, or the lower back taking too much work. So the two approaches to addressing that long term would be assess biomechanically whether other body parts could be doing more, or is it that you just need to build up work capacity and tissue tolerance in that lower back itself. If you have a back spasm, it's probably not as bad as it feels, and slow progressive reintroduction of movement will calm the nervous system, which will eventually ease the back spasm. But just be patient and try to be systematic and progressive going through it. And basically, if you've had a slipped disc, make sure you get an MRI to check out how severe it is, and the advice will depend on the severity of that slip, but definitely seek medical advice if it's sharp, tingly, sudden pain.
I think that's the key one, because most people are like, well, how do I understand when it's a disc bulge? And I think that is what we alluded to at the start, and like what Ash just said there, sharp pain normally means you've done something a bit too bad. That's normally your gauge of you fucked up, and you need to then get it checked out. Because if it's not and it's more muscular, you think, okay, cool, this is probably just going to be something that's going to take a couple of days for me to feel confident again and get back to movement. But as we've said, keep moving within what you're capable of doing, because it's really going to help. And even little things like, just like I say, trying to gently touch your toes, like going towards that direction, just say, okay, cool, oh, I can actually bend my back. It's those little confidence markers that give you that ability to actually get back to training again. And that's kind of where we're all trying to get back to, right? And I think one of the things that you mentioned earlier as well, that generally stability is more important, and to make sure that your body is working as one, and so that your lower back isn't doing too much. That's key. So anyway, guys, we hope that you kind of pulled a couple of nuggets here. And if you are suffering with anything, do drop us a message. We'd love to hear some of your stories. Maybe you've gone through from back pain and gone at the other side, or maybe you're currently suffering back pain and you're feeling a bit lost. Drop us a message, and we'll be sure to try and give some help, maybe booking an assessment, and go from there. So as always, thank you very much for your time. We really do appreciate it. If you did enjoy today's episode, we'd love for you to share it on social media. Tag us at lunge.lift. You can head over to YouTube and subscribe. That'd be a nice way to support the podcast. And if you want to leave us a review, please do on any of the platforms that you're listening to. We really do appreciate it. So as always, thank you very much for your time, and we will see you next week.
Thanks, guys.